Up next, we're going to be looking at how Abu Dhabi is rewriting the blueprint for care through genomics and AI. Please welcome to the stage Dimitris Moulavasilis, the Group CEO of M42.
So thank you so much. Good afternoon, ladies and gentlemen, excellencies, partners and friends. It's a true honor to be here with you today discussing a subject that is at the heart of all of us, how to rewrite the blueprint of care, hopefully not incrementally, but fundamentally. Many of the speakers earlier today have spoken about the health systems which are under strain. We see costs are escalating. We see chronic disease is rising. We see the gap is widening. We see for decades we have been focusing systems that they are built around treating sickness as opposed of preserving health. But today we have two powerful enough tools to change this blueprint, and this is genomics and artificial intelligence. Together, they allow us to shift from reactive to proactive, from late to early, from treatment to prevention. In the United Arab Emirates, that I have the privilege of working the last 18 months, this shift is happening now. And it was only 50 years ago, in the 60s, when every 10 births, we had, every 100 births, we have, unfortunately, 14 funerals. This was when the health system was at its infancy. Until that is the nation's founder, His Highness the late Sheikh Zayed Al Nahyan, envisioned building this sector. And I think today there's a story that articulates the impact he's made over the years. This is a story of Aisha Lake. Aisha Lake is a human resource leader who moved here in the UAE 30 years ago from the UK. When she arrived, she remembers a basic healthcare system. After hearing about the Emirati genome program during a routine COVID test, Aisha hesitated. She wasn't sure whether she wished to learn about her genetic risks. But as a mother of four, she also felt the responsibility. If I drop dead, she said, what information would I leave behind for my children? So Aisha opted in, and what came next changed her life. Genomic analysis revealed that she carried a BRCA1 mutation associated with ovarian risk, a silent risk she never knew that she had. Cleveland Clinic Abu Dhabi recommended a preventative hysterectomy, and 3 weeks later, she had a life-saving surgery. Since then, 2 of her children opted in the same programs, and 2 they're about to come. Her decision protected future generations. I think this story of Aisha illustrates the foundational principle of the new blueprint of care. Identify risk early, empower individuals, prevent disease before it begins. Ladies and gentlemen, genomics give health systems a superpower, the ability to look years or even decades ahead. And here in the UAE, the Emirati Genome Program, which is one of the world's largest population genomics initiative, have sequenced more than 850,000 genomes to date, building a national data set of extraordinary depth. At M42's Omics Center of Excellence, the largest outside of the United States, we are doing both short and long sequencing, and we're doing it at 30x depth. We then continue to analyze this data, identify risk markers, and issue personalized reports at a scale once unimaginable. This is a sequence once and use for life, new paradigm of lifelong health intelligence. It means detecting hereditary mutations before disease, designing risk-reducing pathways like the one Aisha followed, improving drug response through pharmacogenomics, and empowering families to make informed decisions together. For countries in the global south, where health data is scarce, funding is limited, and late-stage disease common, genomics is not a luxury, it's a pathway to equity, and we are already working with several of them, helping them deploy their own genomics programs and helping them leapfrog the traditional healthcare systems once developed in more developed Western countries. Now, if genomics contain the information of what may happen, AI shows us when. AI is not a buzzword. It's the most important tool we have today to transform care, driving outcomes, reducing costs, and improving access. According to this study from McKinsey, AI could generate up to $360 billion annually in healthcare savings alone in the US by improving diagnostics and early interventions. I would like to bring to this audience one example from our global renal care network, the Verum. Renal patients face a risk of thrombosis. Now, for the ones not familiar with dialysis, this is an arteriovenous fistula, which is a surgical connection that's made between an artery and a vein, facilitating the placement of needles are connecting the patient to the extracorporeal blood circuit. Unfortunately, fistulas may get thrombosed at rates of 0.11 to 0.5 episodes per patient per year. A vascular access thrombosis event has a major impact on patients with increased suffering, hospitalizations, morbidity and mortality from infections and cardiovascular events. It has also a major impact at the healthcare systems with increased procedures such as thrombolysis and catheter placement, hospitalization, and respective financial burden. Our teams have developed an AI model which predicts vascular access thrombosis a full week before it happens, enabling our physicians across 24 countries to prevent it. This is not science fiction. This is live today across the globe with several other models that predict mortality, hospitalization, personalizing dialysis care. Now imagine this power applied across every care domain, every disease area, from predicting heart failure before symptoms begin, identifying who is at risk of diabetes years earlier, preventing stroke with silent pattern detection, or radically cutting hospital admissions through AI-enabled early warning. So I guess you may ask, so why this is not happening already? I mean, the fact is that this kind of transformations are not happening by institutions or with pockets of innovation. It happens with ecosystems. This is when researchers, providers, policymakers, inventors, investors, they come together to redefine care. I think This is what I have experienced in Abu Dhabi the last 18 months. This is at the core of the policy of the state and the Department of Health. This is what we at M42 fully embrace. I think this is what has been well reflected yesterday with the announcement of the Future of Health initiative. I would like to close this presentation bringing back to Aisha. I think Aisha's story is not a story of a woman avoiding cancer. Is what we can achieve bringing today the data from genomics, human intelligence, AI intelligence collaboration. And I would like to close this small contribution to this event with a call, an invitation. I would like to invite all of you to work together in both co-developing AI models, in sharing best practices, protocols, insights, in collaborating, designing the future of health, because the future of health will be delivered only by the collaborations of all these leaders in this room, and you are all very welcome to work with us, should you wish so. Thank you so much. Thank you.